From RF Smart, this is On Par, a podcast that delves into the very heart of the healthcare system, its supply chain. And here's your host, Sarah Archer.
Hello, welcome to On Par, the RF Smart Healthcare podcast. On this podcast, we are going to talk about healthcare supply chain, and of course, having a really great ERP partner is the first step in a better overall supply chain. And so today on Par, I've got two special guests joining me. I have Bill Brewer, who has been on the podcast before. If you haven't listened to our introduction episode, make sure you go and check that out with Bill and Joey. So Bill's going to be my co-host today from RF Smart, and then our special guest is Kristen Miles from Oracle. So Kristen, I'm just going to go ahead and let you introduce yourself a little bit.
Hey, thanks so much. This is Kristen Miles, and I am a Senior Director of Product Strategy for Healthcare Supply Chain at Oracle. And I'm really responsible for making sure that our Oracle Cloud supply chain applications are meeting the unique needs of our healthcare customers. Prior to arriving at Oracle, I worked at GHX, otherwise known as Global Healthcare Exchange, for 12 years, working with both our provider and suppliers on optimizing their supply chain processes. And prior to that, not to date myself, but prior to that, I worked in a hospital and as a clinician in the operating room, and then I moved over into supply chain, where we realized that clinical expertise was really required to make healthcare supply chain fully connected and meeting the needs of the organization. So that's my background, Sarah, and I'm really excited to be here. Thank you so much for having me today.
Thank you, Kristen, for being here. And I have to give a special thanks to Bill, who got you here. Bill, you and Kristen go way back, right? What is your friendship with Kristen?
What is our friendship? Yeah, so Kristen and I actually met when we were both at GHX, as she mentioned. I was a product manager there, just like I am over here at RF Smart now. And we enjoyed a great working relationship there. And I think, Kristen, you left about a year before I did. And I took some time and went work back for Tenet Healthcare and worked in supply chain before I came over to RF Smart. And so it's sort of been like a homecoming, coming back not only just to Kristen, but a few of the other folks both of us used to work with over at GHX as well. So definitely excited to be here today and to spend some time talking about this with Kristen.
Absolutely. Well, guys, thanks again for being here. I just want to jump into our topic today. Today, we're going to spend a little bit of time kind of just talking about trends that Kristen, as an expert in the Oracle space, is seeing in healthcare. And so, Kristen, I'm going to kick it over to you and let you just start with some of those trends that you're seeing.
Yeah, so it's really interesting. So healthcare supply chain has really gotten kind of to the top of mind in not just within our hospital communities, but really around the globe. With COVID and the pandemic, people really realize that shortages and disruption in supply chain can not only be inconvenient, but can directly impact patient care. So we're seeing that with that, there's become a renewed effort to kind of jump in and apply better technologies, reinvest back into some of those operational areas, which is really exciting. And we're also seeing that because of these disruptions in supply chain, we're having to look at more advanced technologies, machine learning, things like that, and really being able to apply some of these, tried and true supply chain practices that maybe folks outside of healthcare for decades, and really trying to modernize our healthcare supply chain here, not only within the U.S., but really around the globe within the healthcare space. In addition to that, we're also seeing kind of the care for patients moving outside of the brick and mortar facilities and into the patient home. And with that, you can imagine the complexities that adds from a supply chain perspective as well, where patient clocks out or is discharged because maybe they have an acute episode and have to go into the hospital. They leave there, and the hospital needs to make sure that they're shipping supplies to that patient's home so they can do ongoing monitoring and things of that nature. That are put that into practice today, and sometimes those supplies around home before the patient, which is really a shining example of how our folks are becoming more agile and willing and able to meet the changing needs of their organization. So I'm really excited for where we're going. There's more and more partners in the ecosystem that have kind of come to the forefront. Those partnerships that Oracle sees are becoming deeper, more ingrained, and really are where we're adding value back to our customers is in that collective kind of larger partnership circle, of which, of course, RF Smart is one of those strategic partners.
So I love when you're talking about bringing in kind of modern supply chain tactics that are being used outside of healthcare into the healthcare supply chain. On our introduction episode, which of course, if you haven't listened to, you should go listen to now, it's linked for you. But on that episode, we talked a little bit about the COVID disruption and how oftentimes, up until really very recently, supply chain was one of the first things that got overlooked in healthcare. And so people really bringing that to the forefront and starting this kind of movement of prioritizing supply chain in healthcare is kind of amazing. And so, of course, a big part of that is people taking a look at their technology and saying, well, what do we do now? And a big piece of that, of course, is ERP, which, of course, Oracle is a partner of RF Smart for the ERP portion of that. And so there's many different kind of components and partners that can work together to provide a really robust system to support this new modern supply chain movement. And of course, for Oracle, RF Smart is one of those partners. Bill, I would love it if you would talk a little bit about our partnership with Oracle and kind of how all of that works together in this modern supply chain movement.
Yeah, absolutely. And I'll just begin, Sarah, by echoing some of the comments that Kristen just said. I think it's a really exciting time. I've been in this industry for about 15 years. Kristen, I know you and I both spent a lot of time working and seeing various pieces and parts of the industry, but it's a time where, to your point, Sarah, so much of supply chain has been seen as kind of transactional activities, and to see it really being elevated and the focus really there, I think we're going to see a lot of innovation and progress, and I think it's a really exciting time to be in this space. But specifically to your point, Sarah, while we as a company at RF Smart have enjoyed a great partnership with Oracle for over 20 years, working across multiple products such as NetSuite and things like that, it was really back in 2014 that we began our partnership in the Oracle Cloud space. We actually now have about 25 mutual healthcare provider customers where we're working together to really demonstrate the value of bringing things like mobile devices to the supply chain. And so what I think is really exciting is RF Smart, partnered with Oracle, is really able to extend the power and functionality of Oracle Cloud to mobile devices. And we're solving for things like par counting, receiving, delivery, and things like that. And I think it's a great testament. You use the word, Sarah, partnership, and I think really it goes back to that. And I have this great pleasure of working with somebody that's been a friend of mine for many years, and working together to really push our collective roadmaps forward and really bring great products to market and solutions that are actually solving problems for our customers. So I think it's a great time to be in this space, and I love what we together are able to bring to the table to begin to solve for some of those challenges that Kristen just mentioned.
I was just thinking, I don't know if either of you have a story that comes to mind, but a story just kind of about that tight partnership. I think one of the great things about, RF Smart customers specifically is they do have a really tight integration with our team, and Oracle, of course, has a tight integration as they are working together. Is there any stories that come to mind about that?
Yeah, I'll start with one, and then Kristen, I'll let you kind of share your thoughts on it as well. But there's a customer that we share sort of up in the northeastern United States, and a fairly large healthcare provider. It was actually one that I spent about 2 months working very closely on site with. Great strategic healthcare provider in that market, and they went live with Oracle Cloud and RF Smart back in April. And so through sort of being on site, not just myself but our entire team, along with their implementation partner, we sort of helped them through those initial challenges associated with really any ERP go live. And as we sort of emerged from the initial throes of the go live and really beginning conversations around how do they begin to now optimize their supply chain? How do they begin to take some of the more advanced functions of both RF Smart and Oracle Cloud and build that into their operations? I was there on site, and I immediately saw the opportunity for Oracle and Kristen specifically to come in and engage with this customer that was really proving out to be somebody that could really be a strategic partner to both of our organizations, very progressive in their thinking, really pushing the envelope forward. And so that all came together with Kristen actually coming on site with me to that customer. We spent some time with their VP of supply chain and really dove into where there were some opportunities. And I think, Kristen, you've actually had the chance to continue those conversations as well.
Yeah, no, I definitely have. And I was so grateful to you for recognizing that, we had an opportunity here to kind of advance their supply chain, but also to get kind of a really forward-thinking customer. And as a result of that meeting and that onsite, we were able to get that customer positioned so that they could be an early adopter of some of the functionality that the Oracle Healthcare supply chain team has been developing specifically to meet the complexities of healthcare supply chain. And so as such, they are getting ready to adopt our external purchase price management solution, which we just brought out this quarter. And in that, they'll be able to receive all of their complex pricing from their GPOs, they're locally negotiated, and really boil all of that contracting efforts down to a single price for a requisitioner, which is a key in healthcare. We have such great contracting supports for our healthcare customers and for all of our hospitals, but with that support comes additional complexity. And so we need to now let the technologies really support the maintenance of that work. And external purchase price management from Oracle is helping them do that. And this customer was ready to kind of step in and work with us to make sure that it met the needs of our healthcare customers. And I really am fortunate because that would not have been uncovered were it not for this partnership with RF Smart and specifically my relationship with Bill. So I'm really grateful.
Kristen, sometimes segues are hard, but in this case they are not, because that is a perfect segue into the question that I was going to ask you next. I was sitting here thinking about, with a company like Oracle, who is working with so many different customers, there's obviously this need to evolve in order to meet the needs of healthcare, and especially after what we just experienced in 2020, and now as people are modernizing their supply chains, there's this real need to continue to evolve, and I know that you recognize that as somebody who's in it every single day. One trend that I know is a passion of yours is recall management. And this is kind of an area where people or healthcare supply chains tend to struggle. And so Oracle is kind of adapting to meet those needs. Would you talk a little bit about that? And Bill, I know that you've got some thoughts to add here too, so I'll let you jump in as well.
Great, thanks. So yeah, I am super passionate about recall management. I think it's one of the places where, as a clinician, it directly impacted the health and quality of the care that I could provide. Making sure the new recall communicated to us and to my organization, I wanted to make sure that was getting into the appropriate hands. We were removing all of those parts and pieces that were impacted off the shelves so that it couldn't cause any harm. As such, we developed, that was one of the first major initiatives that I was able to undertake when I came to Oracle. We developed a recall management solution specifically to meet the needs of our healthcare customers. It's actually grown beyond that now, where, as you can imagine, suppliers are interested in expanding its capabilities so that they can use it to communicate with their customers, both in and outside of healthcare. So it really is a need that kind of spans industries within the supply chain realm. So I'm very excited about it. The solution itself, and this is another great place where we partnered with RF Smart. We knew that in order to have an effective solution, we needed to have a mobile scanning component to the solution. So we worked with RF Smart to ensure that once the items were identified and the location of those items were identified, that the RF Smart technology could then step in to help support counting and removing those parts and pieces. Bill, do you want to kind of talk about how that worked a little bit and how that kind of all comes together for one cohesive solution?
Yeah, absolutely. And I think, to your point, Kristen, like, this is the power of the partnership, because, we had the great opportunity almost going back a year ago, I guess it was now, as you guys were sort of working towards bringing this to market, and really partnering with Oracle, including their development team, to really understand the solution so that we could develop the complementary mobile side of it, right? So giving, as Kristen described, the ability for end users to not only in Oracle identify that product that is on recall, but then to be able to go out and actually, identify, find, grab, quarantine that product and effectively get it off the shelf. And so that is, in fact, what we've been working towards developing on our side is that mobile enablement piece. And so it's kind of an exciting place we're in right now. We went through all those months of kind of talking about it. Kristen and I sort of put our heads together a little bit and thought about who could be some potential early adopters or beta customers out there. And we're actually right now working with a mutual customer through the testing and implementation of the mobile side of mobile recall. So it's very exciting. I think, as Kristen said, this is a space that is oftentimes, I won't say overlooked, because I think there's awareness of the need and criticality of it, but it's a space where I think there just really hasn't been a lot of great solutions coming to market. And when you think about combining the power of the ERP with a mobile solution and these recall notices, I think you begin to bring together all the various pieces and parts to effectively drive at the goal that Kristen, is trying to solve for, which is reducing the patient risk and improving patient safety to get these items off the shelf. So it's been a great journey. I'm very excited, hopefully here in the next couple of months, to bring this fully live with the early adopter that we mentioned, and then be able to tell that success story for other opportunities in the future.
That is amazing. I love hearing about supporting customers by listening to them. I think that is critical, especially in technology and especially in healthcare, because for a lot of people who, maybe in the supply chain industry, healthcare is kind of a little bit of a different world. And so having people like you, Bill, who has been in healthcare, like you, Kristen, who knows the ins and outs, to be able to listen and help and communicate that in the development of the product is just really outstanding. So thank you guys so much for listening to our customers and coming up with great ways to help them. As we kind of come to a close today, guys, I wanted to sort of come full circle, because we started by talking a little bit about industry trends, and I was thinking about the people who are listening today. Many of them have probably already made a decision about which ERP they're going to use, and they may be thinking about implementing some supply chain modernization, like we talked about earlier, potentially with RF Smart. Maybe they've already chosen RF Smart, whatever that may be. But as we kind of close out today, what are some of those next steps, those trends that you're talking about that you think that people should be implementing, maybe as a part of their phase 2, or maybe as they're kind of making decisions about ways to modernize their supply chain? Kristen, do you want to go first?
Yeah, thanks. I'm really excited about reporting and analytics and being able to take that new modernized cloud ERP and start to combine it with other data sets, right? Things from the EHR, et cetera. Because one of the other trends that I'm seeing in healthcare is this need for our customers to have to really take a hard look at service lines and what service lines that they're offering to customers and where they're offering that. As an example, some big IDNs have hospitals all over a region, and some of those hospitals may offer cancer treatments and others do not. And really trying to take a look at, where are my patients? How long are they having to travel? Where am I profitable and where am I not profitable? And the supply chain is a huge piece of that. So being able to take in all of that data from the ERP and combine it with these other analytics is really going to be key. So it's really understanding the business questions that you need to be asking. And as you go to implement, really understanding where those integration points are with those downstream third-party systems that are going to become critical for helping to continue your business, allow you to maintain margins so that you can continue to offer the best care where your patients are. So I think that's a major piece there, as well as really taking advantage of some of these initiatives such as diversity and inclusion initiatives that many of our healthcare customers have. And as you're going forward and setting up your ERP, it's the very perfect time to be making sure that you're including attributes that you can then report on down the line to help support some of those initiatives. So I really do think that as folks begin to modernize their supply chains, there's a huge wealth of opportunity to really be able to kind of grab it, transform it, and then begin to report on it, which I think is really going to be the at the end of the day, the big critical piece.
So true. And I think that this is worth saying here. One of the values of using a cloud ERP or cloud technology is that those things are always up to date. So when you're grabbing those reports, looking at those analytics, beginning to make those decisions, those things are always updated for you and ready to go. And especially when you start talking about things like the recall management or other functionality that we spoke about, when things like that update, they're automatically updated. There's no more manually having to update things. And so there's really a lot of value from being able to see things in real time. Speaking of seeing things in real time, Bill, I feel like I know what you're going to say to this question, but what do you think that people should be considering as they continue with their supply chain modernization?
Yeah, and you've probably heard me say it in some of the other podcasts as well, but I'll re-echo it here. And first off, I would say, Sarah, before I answer that, I completely agree with what Kristen said. I think a lot of the power rests in the data, right? And so the last 10 to 15 years, the story of really the healthcare ecosystem has been a modernization of clinical systems, right? So you've got a couple of the big EHR providers out there that we've seen most of the healthcare providers in this country implement one or the other, and really taking what was very paper-based, methods of managing patient and clinical information and transforming that into electronic information. And I think, as we've talked about today, sort of a similar transformation now going on with modern ERP solutions such as Oracle Cloud. And Kristen, you couldn't have said it better. It's like, how do you begin to bring all those pieces together? Because if we don't, then all we've really done is just made our data prettier, right? And so the power is, how do we begin to bring all that together and actually use that to improve outcomes and improve operations? And speaking of improving operations now, Sarah, getting around to your question specifically, so that from where I sit and the role that we as a company at RF Smart provide is, we're also very focused on driving operational efficiency in the supply chain, right? So being the mobile enablement arm of Oracle Cloud, what I'm very happy to report and what I like working with our customers around is, how do we begin to take things like receiving and par counting and delivery tracking and all of those various things that we solve for relative to inventory management, and how do we make those more efficient? Because I think I've said it before in a podcast, the supply chain is always being asked to do more with less. And so if we're being asked to do more with less, then the only way to really continue to evolve that is to create operational efficiency. And I think, our mobile solutions can take what otherwise would be, paper-based processes or more cumbersome processes and really transform those and make those as operationally efficient as possible. So I think that's the role that we continue to play in this equation as well.
So true. Totally agree with you, Bill. Guys, we only have a little bit of time left today. So while I've still got you, Kristen, I would love to hear kind of your parting wisdom for our listeners. What is the one thing that you wish every person knew as they were investigating or potentially even implementing this, supply chain modernization, as they're thinking through these trends? What do you wish that they knew?
It sounds a bit trite, but I will say again that it's really about the data and taking the time to get your data clean and enriched and ready, whether that's your item master, your supplier list, your contract data, just being able to change and update your chart of accounts, but really knowing that what you're implementing a a true, clean set of data that's ready to grow and expand as you as an organization grow and expand. I think if nothing else over these last 15, 16 months through the pandemic, we've realized that we have got to be flexible, and you can't start to flex until your data is pristine. So really, and it takes a long time to get it there. So it is not an overnight cleansing option that really exists out there. And I really want to make sure that our customers, as they're going to these more modern supply chain technologies, are really taking that into account and knowing there's some hard work that lies ahead to get that data set correct, but that it will pay dividend in the end.
Hard work is totally worth it. I agree. Well, Kristen, thank you so much for joining us today. Bill, as always, thanks for being here. For those of you listening, if you liked this podcast and you'd like to be automatically notified when one comes up, you can do a couple things. You can subscribe on Spotify, Apple Music, Google Podcasts, anywhere you like to listen to your favorite podcast. Make sure that you hit the automatic notification button so that you automatically get it downloaded to your phone. You don't even have to do anything. When a new episode drops, it'll be there for you. Or you can go to rfsmart.com/onpar and you can subscribe using the email list option there. So if you're not a big podcast person, but you love this podcast and you'd like to listen to it and get an email every time that one drops, that's the place to do it, rfsmart.com/onpar. We mentioned some other podcasts and, of course, some other resources. Those will be linked for you down in the description of this podcast or at rfsmart.com/onpar. But thanks again, guys. Thanks again to Kristen. Thanks to Oracle and to Bill. Thanks, guys, and we will see you again soon.